כן, זה מצלם.
Okay, so
English.
today is the
22nd, I think.
22nd of September
September.
2010. And,
I would like to ask a question regarding psychology.
psychology, you don't pronounce the P.
I don't pronounce it, okay. Psychology and therapy in particular. And look at it in a more consciousness view
Okay.
on the matter. After a bit studying about myself, I came to the understanding that people are not aware of themselves, and they don't do any work on themselves. And
But you know, these phrases, people are not aware of themselves and do not do work on themselves. When someone watches YouTube and find these words, they're quite meaningless because, you know, I know many people, they would say, what do you mean I'm not aware of myself?
it's
Do I have to be aware of what? Of my liver, of my breathing, of my bodily sensations, of my thoughts? What do you mean aware of myself? And, what do you mean do not do work on themselves?
Yes.
Does reading The Secret means that you do work on yourself? Positive psychology,
yes,
guided imaginary, is it work
Yes.
on yourself? What do you mean? So these two sentences, I'm not sure are very clear. You're talking on something that has meaning for you,
yes,
in your own vocabulary, in your own language.
yes. I think there is a big gap here to catch up. When I'm talking about inner work, I'm talking about
Let's talk about psychology in a way that everyone could understand, in terminology which is common to everyone,
yes.
right?
Well, mainly what I see in psychology, sorry, is that it's totally intellectual.
So you are coming straight from the beginning with a judgment about psychology.
Yes, I have.
How can you come to understand psychology if you judge it from the beginning?
Yes. I have.
There is a field, an area that people study for many years, that people made many researches about, have a lot of theories about, which is called human psychology. Anything which is less physical in the human being, I think you can call either psychological or spiritual.
Yes.
And when you say it's intellectual, you already dismiss it
Yes.
to be worthless. So if you want to understand something, we need to think about what it is for what it is, by its own nature,
Yes.
and without etiquettes.
So, but there is the field of psychology, of the researches and all the academic work and publishing that is going on, and there is actual therapy sessions where a patient sits in front of psychologist, and psychologist may be asking questions or listens to the person, and the question is what really goes on there.
What goes on in a psychotherapy?
Does it have to do with all the researches and all the things that is there a real method to fix somebody's brain or his emotions or things like that in order for what? So there is a lot of question marks here.
Yeah, I think these are very good questions. Is psychotherapy a real method?
Yes.
When you have real means to analyze
Yes.
a complaint or problem, the person, and do you have very specific methods of helping him, and by helping him, do you cure?
Yes.
Do you bring a remedy?
Yes.
Do you ease the symptoms? And well, I think that in psychology we have many methods.
Yes.
There are many methods. I can't say we because I'm not a psychologist, but there's methods, and there is cognitive psychology, there's behavioral psychology,
Yes.
there's dynamic therapy. I do not know what exactly psychotherapists do.
Yes.
I suppose if there is anything that a psychologist can do in the therapy, is make a person conscious of the truth of his situation.
I have a very big objection to what you say.
From your own experience.
From my own experience and from the experience of knowing other psychologists and psychologists and talking to them. And well, last Friday I talked to a psychologist, a clinical psychologist that works in dynamic
therapy.
And she made a very similar list to the sorts of psychology.
Not sources, methods.
Methods, existential, dynamic, cognitive, all kinds of. And I asked her, well, which one do you pick? And she said, well, I'm personally a dynamic, but if you really ask me, and if you really ask psychologists, they would say that the method doesn't matter. What matters is the chemistry that is created between patient and therapist. So again, here I can have chemistry with my good friend. I can.
Yeah, you don't need to be a psychologist to have chemistry with the patient.
She actually said that it has nothing to do with all the, I think, 7 years or 8, 9 years of process.
So with that she dismisses the whole study of psychology. Because obviously you don't have to have to study to have chemistry.
Yes. So, if all the things that you learn, what good is it for?
Well, I really think the only thing that psychology could bring is consciousness. I think that the main problem of human beings concerning things that they are not satisfied with in their psychological social lives is repression and self-lies and hiding the truth from yourself.
Okay.
And I think the only thing that the psychologist really can do is take the veil of the eyes of the person and force him to combat with the truth of himself.
But isn't it, suppose have schizophrenic patients?
Here you cross the line.
Okay.
Because psychologists deal with neurosis, not
Okay.
with psychosis.
Okay.
Neurosis is a disturbance.
Yes.
Psychosis is a major defect.
Yes. Okay, so
This is actually a twisting or a warp in the perception that you have of the world.
yes.
Psychosis.
Yes.
Neurosis, there are things that you're not happy about
Mhm.
and you're not pleased with, causing you to a behavioral response which is not beneficial for you.
Yes.
And psychologists deal with neurosis,
Okay.
not with psychosis. I must say this is very strange for me, because clinical psychologists go through a training of at least 7 years.
Yes.
If we talk about their masters and the training that they have later on, supervision, all the rest of it, at least 7 years
Yes.
to be able to be psychotherapists.
Even more.
Even more. And to be a psychiatrist, all you need to have is 3 years. And even then you don't study anything, you simply are in internship
Yes.
in a psychiatric department,
Yes.
where the most effective way is medicine.
Yes.
And psychiatrists supposedly are treating cases which are much worse than psychologists, and they study less.
Yes.
And what they have is drugs which could be very, very powerful.
Yes, but it seems like psychiatry is like taking a big hammer and giving it a correction, and psychology is really trying to go into the depths of things. Allegedly tries to do so, and try to figure out and.
Yeah, but it doesn't contradict what I said. I'm saying the problem that psychiatrists deal with are much greater than the problems psychologists deal with, and psychologists study much more than psychiatrists.
Yes.
And what they study is a doctor, in most cases, has got nothing to do with the schizophrenia or paranoia, because
Yes.
it's got nothing to do with physical things. A person could be totally healthy physically.
Okay.
And I more look at it as psychiatrists studying for 7 years to be a doctor. We say, well, a good person, you study, you are serious,
Yes.
you can deal with psychotics, we'll give you some training in the hospital, and
Yes.
it's like a person that was a general manager of a car factory. And because he was general manager in a car factory, he goes to be general manager of a publishing company.
Yes. I understand.
So you're great caliber. As a doctor, you probably could be great caliber dealing with sorts of people. What is the connection? I don't understand.
I understand. So, okay, so what other questions I had for you regarding the psychology? I wanted to ask you, how do you think, what do you think about the Oedipus syndrome, for instance? What do you think about people who, the theory that men want to have sex with their mothers and compete with their fathers?
I think this thought maybe crosses the mind of the kid once or twice, but to make out of it a major complex, I think it's exaggerated.
Yes.
And it's very natural to be attached to your mother. To want to have sex with your mother? I doubt it. You get angry at your father from time to time.
Mm-hmm.
And when you're angry at someone, especially if you're a kid, you want to kill him.
Yes.
But to make out of it an Oedipus complex, I think it's very exaggerated. Basically, I don't know of any complexes that people carry.
Okay, so imagine the situation that there is a psychologist and there is a patient, and the patient says that expresses some Oedipal syndrome, and therapist says and writes something in his and in it he writes that he has syndrome of the Oedipus problem. So what can you do with it?
What do you mean?
What the question is, what next?
What do you mean? I don't understand the question.
How can it progress the state of the patient? Understanding that
It can't.
so what's it good for?
Nothing.
I can understand that it's a spicy story, but
Yeah, I don't see how it is productive. The Oedipus complex, all the rest of it. I don't think that. I think that psychology or psychotherapy puts too much emphasis on the growing conditions of the child as a factor which shapes his psychology.
yes,
I think it's overestimated, the relationship with your parents and all the rest of it. I'm saying the relationship with your parents and your growing background as a kid, all the rest of it, as long as there wasn't happening anything extreme, such as child molesting and rape, or extreme cruelty, or a lot of aggression, extreme aggression. If we talk about the 80-90% of normal childhood, with the normal misbehavior and ignorance of the parents and the fights between kids and parents, the normal thing, I don't think it affects the psychology of the growing child a bit. I think that basically the psychology is influenced by genetics, almost 100%. And then you have the adoption of this genetic psychology to the social conditions in which the kid finds himself. And you adopt yourself according to the conditions.
I understand. So,
and in the fashion of your own character, which is inborn. I think basically the family, I'm going to say something quite extreme, is the least important factor in shaping the psychology of the kid.
I understand. That's something very radical. I think nobody would, when he hears something like this, would say that the family.
I think about it. Kid come home from school.
Yes.
How much room does he give for his parents? How much consideration does he have for his parents, for what they say? Does he consider them as a factor or a force in his life?
Not much.
Not at all. Kids do not consider their parents. They dismiss them altogether. The family is not a force at all in shaping the behavior of the child.
Yes.
Today in our society, the family lost its power and its authority.
Yes.
The authority much more rests in the group of kids that surrounds this kid, whether he's popular or not.
Yes.
But the family? Basically, the person comes to the family, he doesn't consider his parents at all. They don't exist. They are air for him.
Yes.
Society took from the family all the power that it has, like society took from the teachers
Yes.
all the power that they have.
I understand. So, if
The
I
social ladder,
Yes.
the success in the social environment, and the progression that you make or don't make within the social environment in which you find yourself becomes much more important.
Yes. So, in the eyes of society, family is just an incubator.
Yeah, it is a facilitator.
Yes.
A child needs the family, yeah, as you said, incubator, to take care of it
Yes.
until it is big enough to get integrated into society and to contribute its share
Yes.
to the function of the industrial wheel and the commercial wheel.
I understand.
And after the family it's done its share and the kid is standing on its own 2 feet and can earn a living, the family is redundant.
Yes. I understand.
So I think all this overestimation that psychologists give to the family is divorced from reality.
You put the emphasis on the sociological aspect.
Yes, and I think basically what psychologists do when they put so much responsibility upon the family on shaping the psychology of the kid, they are making the parents to be the scapegoat
Yes.
of most of the psychological problems that people suffer from.
And then the patients, in a way, they misjudge, or they, instead of pointing out the sociological aspects that shape them, they put it on their parents. So not only they don't see or don't consider the parents, they only consider them in a negative way.
That's right, as a scapegoat.
As a scapegoat.
And I think that being the psychologist is a messenger of the norms of society, it can never transmit to the kid or to the patient, the person who comes to the treatment, listen, much of the problems that you suffer from is because we live in a very cruel, mediocre, non-humanistic society. It doesn't have the mandate
Yes.
to say that, because he is representing that authority
Yes.
and that establishment. But if I have to think, who are the people that suffer the most neurosis? They are the most sensitive, the most delicate, the most vulnerable, the most creative, the most artistic, the most spiritual people.
Yes.
The more fine you are in your soul, psyche, psychology, the more fucked up you will become.
Yes.
Because you meet very cruel, non-humanistic systems,
Yes.
first of all in school. But a psychologist meeting the kid suffering from this neurosis couldn't say to him, listen, this is because you are too delicate and you meet society which is cruel and mediocre.
Yes.
He needs to find a scapegoat. And who is scapegoat? These poor people that gave their heart and their soul to their kids,
Yes.
wanting them to be the best they can, and in the end, they are becoming to blame.
It's a very
Radical.
radical and hard truth, and maybe conspiracy against the
Parents.
against the parents, and maybe not against parents, against the elder part of society. So I can't think about psychology and think it evolved from the wise men, I think. So the concept of coming to get advice for something.
Yeah.
So I think that before psychology took over this role in society, it was the elder people
In the tribe.
in the tribe that were sitting and using their experience from life. They could share it and give it to the younger aspect. And if I understand, not this is all turned upside down.
Absolutely. Today, the person who become to be psychologists are the people that have the best grades at school.
Right.
If you do
Very
not have
competitive.
the highest grades, you can't become a clinical psychologist. So you need. So who are the people who gets the best grades in school? Here I'm going to kill another cow. The people who have got the most tendency towards conformity,
Yes.
because the school is a very conformist establishment. And the people who are more outsiders and more rebellions find it more difficult to adjust to this very rigid frame.
Yes.
And the people who are more conformist adjust better, get better grades, and become now doctors and psychologists.
Yes.
So when you get a psychologist, you don't get the wisest person. You get the most learned person.
Yes.
And what does he learn? What society wants him to learn.
Yes.
The norms of society. So here you get a delicate kid or a person that got injured by society, and he's coming to the psychologist to help him with his wounds caused by society. And what the psychologist does is either turn him back against himself or against his loving parents.
It's a very hard truth, and I'm very, very much can see myself in the same situation. And
What I said now for most people will be blasphemy.
yes, nobody will accept this. This is too hard. This is very, very hard truth, and it says that it's escalating. The situation is escalating because society is becoming more and more intellectual, and the more intellectual people are, and the less intellectual people, the more soul people, the more delicate people are being shoved aside more and
Becoming more neurotic,
Yes.
and they are running more to psychologists, and the parents are paying the price. I mean, the parents, which are basically are taking the difficulties of the kid meeting society
Yes.
They give him the love and they give him the support, and in the end they have to pay the price. They have to be blamed
Yes. So there is
for what they're not to be blamed for.
So there is a polarization, bigger and bigger polarization between people who are intellectual to people who are more soul. There is more distance today
Yeah,
than there was maybe 200 years ago.
I suppose so.
And today, if you are delicate and you're born to society, you have a higher probability of becoming insane.
Yeah, it's becoming all very sophisticated. It's very difficult to find who to blame and what to blame. And I think what psychologists should do when they meet these people who are in great psychological difficulties is teach them how not to fool themselves.
Yes.
And how to become conscious, and how to become aware, and how to become wise about what is really happening to you, and not to tell yourself stories to decrease dissonance,
Yes.
and to be able to increase your ability to stand emotional dissonance in order to find the truth of what you really are and what is actually happening to you. That means growing up
Yes.
emotionally. And I think that's what a real psychologist is. And I suppose, I must say that, to balance what I said before, that there are real psychologists. I'm not sure this is what they are teaching them in the universities. But maybe there are people that came to be real psychologists and they realize that their mission is to cause these wounded, poor people to be conscious. And that's what they teach them to be by giving them reflections.
Yes.
I think what Socrates did with this question is cause his students to be aware of the things they don't tell themselves,
Yes.
or the stories they tell themselves to make their life more comfortable.
Yes.
That's the mission of a wise man or a conscious man, to cause a person to wake up to the truth of himself. Know thyself.
I'm quite surprised that you're saying that actually you're saying that some psychologists are wise, and when they are talking from the wise point of view, they're actually trying to cause evolution inside their patients.
Consciousness. Consciousness. To first of all show the person where he is fooling himself,
Yes.
where he is putting under the carpet. So real psychologists, as I understand real psychologists, needs first of all to cause a lot of pain to the person,
Yes.
because he needs to combat truth which is usually unpleasant,
Yes.
and to grow above it,
Yes.
and not to escape from it by telling yourself the stories that will allow you not to meet it.
Yes.
There is no growing up without pain, without self-combat, without meeting the lower you and upgrading it according to your consciousness and understanding of reality.
But correct me if I'm wrong. No, I don't believe. Maybe there is. And I don't think the issue was researched in any way, but or can be researched. That the psychologist, a person would come to a psychologist, and the psychologist and say he has difficulty, and the psychologist will come and say, "Listen, life is hard. Society is hard. You will experience difficulties, and the more you will grow up, the more painful things are going to become, and in the end you're going to die from illness or accident." And as we talked before, the elder people are being shoved away more and more. So basically,
I think you are confusing here the job of a psychologist and the work of the philosopher.
okay,
I think what you're talking about is what a real philosopher will say to a person.
okay,
Life is tough, what do you expect? It's going to be more difficult, and you should be prepared for it.
yes,
But I think people that go to psychology, psychotherapy, and they're going there on the mandate that they're going to help people live more bearable life.
Yes.
Philosophy doesn't have that at all. It wants to find the overall truth of what life is about, and not necessarily to help you live a happy life. Although today there is this kind of philosophy, I suppose, but a person who comes to psychology wants to help people on a soul level. This is his mandate. So he can't come and tell him the things you said.
Yes.
I think the only thing he could do is help him to grow up in his view of him and life, and to have more mature, more balanced, a more correct view of what life is about, what creativity is about, what development of inner capacity is like, and allow him to have a correct view of what life is about, so he can have the most satisfactory life possible within the conditions that we find ourselves.
I understand.
And there is no other way that I know except consciousness. I think that people lie to themselves constantly in order to decrease emotional dissonance. I think that people who suffer a lot lie to themselves more.
I understand.
There's no way to grow up above the level of your problems without becoming conscious. And for that you need a guide.
Well, this is, I think, the most, I think the biggest rejection inside me that
Well, I want to ask you, when I'm talking all this time, for 1 to 100, can you give me the level of rejection that you have, or objection that you have towards what I'm saying? I know that it's going up and down, but the average.
Well, as I am, as you stated in the beginning of the comparison, anti-psychological. When you talk about things that are anti-psychological, it makes me more agree with you.
Can you just answer my question?
Yeah. Say 30%.
It never went above 30? It went above 30.
It went.
What is the highest that it reached?
80.
80.
So there is a question that I want to ask regarding. I would expect that if you're talking about psychologists as an ambassador of consciousness,
Okay.
that is coming to reflect to their patients their consciousness, I would expect them to be conscious of themselves. I would expect that I don't know, the tailor will go in a very good suit, and that the chef will eat refined meals and not go to eat in McDonald's. And,
Yeah, well, you raise a very big question. Philosophically, it could be phrased as follows. Is a good teacher always a good craftsman?
Yes.
Is your level of your teaching must reflect the level of your mastership in the profession that you teach?
Yes.
I think not necessarily. I think you could be a good teacher and a lesser craftsman, a lesser professional.
I think that's totally catching me by surprise.
Well, I tell you why. Because you see, when a person comes to you with his problems, you are objective about his problems,
Yes.
but you are subjective about your own problems.
Yes.
So in order to have consciousness about you, you need to rise up above your subjectivity,
Yes.
which you need a very high level of development to do that,
Yes.
self-work. But it's not difficult to listen to the problems of other people and to be conscious about it, because it's not your own problems. It's objective. So it's easier to be conscious towards other people than to be conscious of yourself. And it doesn't mean that you can't help other people.
Yes.
It's good if you could be conscious of yourself first, but it doesn't contradict.
But nobody is making psychologists or making any estimations regarding the self-consciousness.
No, not at all.
So, if I understand you correct, there is no problem that a depressed psychologist will treat a depressed patient.
It's not accurate, because they do go through a therapy.
Still, but I'm in my personal life, I was acquainted with quite a few psychologists, and most of them were confused people, מתוסבכים.
Yeah.
Don't know how to have
complexes.
a lot of complexes, nothing coherent, and mostly depressed. I had many friends, and I looked at most of the people in the psychological studies when I studied in the university, and most of them were absolutely depressed.
Well, I don't know. I can only talk from the outside because I was never in this. But I think every psychotherapist should go through a session of therapy himself.
They do.
Okay. But I think that the person, the psychologist that passes him this psychotherapy should not allow him to practice psychotherapy if he is depressed.
Yes.
If he does, I don't think it's correct.
I understand. But that's the reality of people maybe are not depressed when they're studying or when they go to the psychological, and then later in life when problems happen, and they always do happen, they become depressed. And
well, the thing is that once you have your diploma as a psychotherapist, you can do whatever you want. No one checks up on you. And you have almost total power upon the people that come to your psychotherapy. People will give you the utmost credit. If you manage to pass the difficult studies and supervision in which they actually watch you how you do psychotherapy, which is not an easy thing,
yes.
and you go through therapy yourself and the committee find you fit, that's it. You have the mandate, and you can do whatever you want with people. There is a certain system which is obviously not perfect, but tries to administer people that will help other people with the methods which are available there.
Yes.
And I think the only thing you can do for another person is help him to be conscious, because you can't do therapy. I mean, you can't cure a problem.
Yes.
No one can do anything for any other human being. The only thing is make a person understand and to be able to administer his life different by becoming aware of what is stopping him.
I understand. And there's another question that is troubling me regarding psychologists and therapists, is that when they are talking and intimate with their patients, in the sense they are subjective to bad energy that is coming from their patients. And I would think that if a person is a therapist for 10 years, there is a very cumulative damage.
Not necessarily. Like a person, a doctor learns not to be personally involved with the difficulties, the problems, the illness of his patients. The same psychologist, he can develop detachment, and they do develop detachment. The problem is different. I don't think there's a problem of becoming contaminated.
Yes.
Because I think the last thing that psychologist does is identify what the problems of his patients, and this is one of the problems.
Okay.
The problem is, how do you become empathic with the problems of your patients without identifying with it?
Yes. That's a very hard one.
Yeah, I think it's very easy not to identify and to become cold towards them.
Or on the opposite.
Or the opposite, which is very rare, I think.
Yes.
That you identify with their problems. You won't last in this profession long.
Yes.
I think mostly after a while you develop this cold front. And whereas, I spoke about consciousness until now, and here's the opportunity to say the other half
Yes.
of what the psychologist can do, which is empathy and humanity.
Yes.
And I think that if a person comes to a psychologist with a lot of problems and suffering, and what he gets back is a listening ear and empathy and humanity, human warmth, I think in many, many cases it helps. Because in many things you can't do anything. But if you get real empathy from someone, it can heal your wounds.
Yes.
And allow you to recuperate, to come back to being able to continue. So these are the two things basically that I think psychologists can do. Give you consciousness about the lies that you lie to yourself, and give you humanity and empathy about the suffering that you go through.
Okay. And last question that I prepared, which is I think is the most troubling maybe, is for me. If you put consciousness training and psychotherapy, where is I don't know, as a person that is working on himself on conscious level, when I look at psychologists and I don't see them do it, or I don't...
Yeah, well, I can't relate to that because it's not right.
Yes.
You see, as a person giving himself consciousness training, you ask me to talk about psychologists,
Yes.
to compare consciousness training, it's not right.
Yes.
I'm already part of this, so obviously
Yes.
I will speak favorably about what I do.
Yes.
But I said what I think of what psychologists could do and should do to help another human beings.
Consciousness is and empathy.
Consciousness and human warmth and
Yes.
empathy, yes. And, to be able to reflect to the person what he doesn't tell himself, or what he tells himself which is not right, and
Yes.
to allow him to combat it
Mm-hmm.
with giving him the right kind of wisdom,
Mhm.
consciousness, and supporting him with empathy and human warmth. These are the two things you can do.
I understand.
I think that the lesser this exists within a psychotherapist,
Yes.
the lesser he is doing the job which I think he should do.
I understand. That's it. Thank you very much.
Okay, you're welcome.